Welcome. With us, Jamie Court is with the Santa Monica-based Consumer Watchdog, which has had a leading role in getting both Proposition 45 and 46 on the November ballot. Dr. Martin Gallegos is a former member of the California legislature and is now with the California Hospital Association, which opposes Prop 45 and Prop 46. Gentlemen, thank you very much for joining us. Jamie, in the any kind of debate, the affirmative always has the first airing. Go ahead and tell us why you put this on the ballot.
Look, health insurance isn't affordable in California. We've got rates going up 5 times faster than the rate of inflation over the last 10 years. And California is one of the few states where there is no state agency, there's no federal agency that can say no to an excessive rate. So we had $250 million in excessive rates. These were rates deemed excessive by the regulators that went into effect anyway. And what Prop 45 does is it puts the brakes on the rates by giving the insurance commissioner the power to say no to excessive rates, and it creates openness and transparency in the process so that we can examine when health insurance companies want to raise rates. We can make the company CEOs under penalty of perjury make their applications so they're not lying to the public, and we can have accountability to make sure that the rates that are being charged are reasonable. And this is really important because we all have to buy health insurance under the federal law, but there is no guarantee in California that health insurance is affordable unless we pass Prop 45.
Now, currently, the insurance commissioner has authority over auto and home insurance. This extends that authority.
It's the exact same laws, and auto insurance rates in California have actually gone down since the voters passed Prop 103 in 1988, which the founder of Consumer Watchdog wrote, and the rates have gone down 0.3% in California in real dollars for auto insurance. They've gone up around the rest of the nation double digits. So this regulation has worked for auto, it's worked for home, and it's also worked in other states. There are 35 other states that give regulators the power to say no to an excessive rate. We haven't been able to get that out of the legislature in 12 years. And we're here with the voters because now we all have to buy health insurance, and there is no one who can stop health insurance companies from raising rates if the companies don't want to stop.
Dr. Gallegos.
Yes. Well, health insurance is not auto insurance. Let's be clear about that. And rate regulation is going to do very little to control the overall costs of health care. As the Affordable Care Act rolls out, that's the health care reform, the main goal is to control costs. And what we're going to see with rate regulation that artificially is going to push down rates, it's not going to do anything to alleviate the underlying pressures that's causing healthcare costs to increase, and it's not going to help reach the goal of the Affordable Care Act. In fact, one of the reasons that we see the rates that we see with insurances is from this dynamic in healthcare called a cost shift. Medicare and Medi-Cal, these are the state and federal programs for elderly and uninsured, vastly underpay providers. The providers then turn to make up that shortfall of reimbursement through the commercial plans. Well, the commercial plans got to make that up, and they make it up by increasing premiums. So what we need to do is government needs to step up. If you really want to see rates come down by as much as 30%, then we got to have government step up and pay a reasonable, fair rate to providers for the services they provide. This cost shift is not new to anybody. It's not new to Jamie, and it's a hidden tax that could be impacting by as much as 30% the premium dollars on health insurance.
But you have 35 states, he says, that actually have an insurance commissioner with authority over health care and health policies, as well as an exchange, and work together.
Yes, 35 states. Not anything like what Consumer Watchdog is proposing. The big difference here is the intervener portion of the initiative. This would allow any outside individual to inject themselves in the process of establishing rates, and the other piece that's not talked about, and impact the benefits that would be provided by those health care plans. So this is the element of the component that could virtually disrupt covered California and the goal it's trying to do, which, by the way, has been very successful in negotiating affordable rates with the health plans that are in the exchange, and has limited their rate increase this year to 4.2%. That's remarkable.
But when you drafted this measure, you didn't have covered California.
Well, we had the passage of the Affordable Care Act, and we did actually grandfather in plans rates for the 2014 year because we knew there'd be an exchange. But the reality is, look, There are lots of states. There are 8 states that have very active exchanges like Covered California and also have regulators. So in Oregon, Connecticut, New York, where they have the power to say no to excessive rates, these states' regulators have dropped by about half the rates charged by the exchange because Covered California covers 1.2 million people. 80% of them get subsidies. Prop 45 will cover 6 million individuals and small businesses who have no one looking out for them. And the fact is, the reason we have lower auto insurance rates in California is we have the most effective regulation, the toughest regulation in the country, and it does drop rates. I'll tell you, on the intervener process, consumer groups have saved $3 billion since 2012 in terms of rate hikes that auto, home, and business insurers wanted to increase, including malpractice insurers. And when we intervened, we stopped those $3 billion in rate hikes, and the cost to the companies that had to pay costs to the consumer groups and our outside experts was about $8 million. So for 25 cents of paid by the insurance companies, $100 was saved by the consumers or the businesses. And the fact is that the states that have tough regulation, and there are states that have very tough regulation, rates come down. In states where insurance companies can do what they want, rates go up. Prop 45 is about getting tough regulation.
How much of it depends on who the insurance commissioner is?
Well, well, look, in auto insurance, we had 2 Republicans, one of whom took some money from the industry, and through this whole period, auto insurance rates have stayed flat because we've had the outside pressure of the intervener system, because an elected official charged with keeping rates low, as we do under Prop 45, answers to the public. So even Chuck Quackenbush lowered rates because he didn't want to face angry voters.
Insurance commissioner, he argues, answers to the public. Covered California?
Well, the intervener, let me get to the intervener issue. The problem is not the cost. The problem is the potential delay that could be created by an intervener injecting themselves in the process and therefore creating problems where folks wouldn't be able to get insured under Covered California because of the potential delays by the intervener. So it's not so much what it costs and what they save. It's the time delay and the fact that you interrupt and you could actually undermine what Covered California is trying to do by delaying for up to 343 days on average in some situations the implementation of coverage.
There are 4 health insurance companies that are funding the opposition campaign to Prop 45 with $37 million, and they cast these dispersions. The reality is there is a year to get rates to market, and Senator Feinstein, Senator Boxer, and the Democratic Party would not endorse and support this initiative if it would disrupt the Affordable Care Act. It just makes the insurance policies more affordable.
We're talking about Proposition 45. We'll have welcome back to News Conference. Prop 45 is on the ballot. It would increase the authority of the California Insurance Commission when it comes to health insurance. Jamie Court is with the yes side. Dr. Martin Gallegos is with the no on 45 side. We should point out you're with the Hospital Association of Southern California, which is affiliated with the California Hospital Association.
Correct.
He just made the argument that it has been disingenuous in the campaign ads that you've been running, your side, indicating that there will be that it will be too bureaucratic and that it will actually end up increasing rates, which is just the opposite of what this legislation would do.
Well, what I'm saying in regards to the impact of Prop 45 on Covered California, we did make that up. In fact, the doctor who was the architect of the Massachusetts healthcare reform wrote a report, and it's his findings that implementation of Prop 45 would indeed negatively impact the ability of Covered California to reach its goal of insuring individuals and covering them, and in fact could actually undermine the whole healthcare reform system here in California. So
that was hardly an independent report, though. This was paid for by the 4 health insurance companies committee that has raised $37 million against Prop 45. So the reality is, when you have a report paid for by the insurance companies opposing the initiative, it's not exactly an independent report.
Right, but you could make the argument, listen, we have Covered California, we have Obamacare, it's brand new, we still haven't seen all the unintended consequences as a result of it. So whatever merit there is for 45, the argument can be made that this isn't the time for it.
Well, but we've been trying. Well, first of all, if people have to buy health insurance, it's the obligation of the state to make sure it's affordable. And the only thing Covered California can do is negotiate. And you can't negotiate with 4 health insurance companies that control 94% of the covered California market because there's no leverage. What Prop 45 does is give leverage actually to covered California, because if the insurance commissioner can say a rate is excessive and that the insurance companies can't charge it, then covered California can actually say, well, you know, in addition to these benefits we want, yes, you're going to have to listen to the insurance commissioner, so give us the best rate. Absent that, it's a free market. And in the free market, health insurance companies, opposed to Prop 45, are able to charge what they want without discretion.
Actually, I think it's quite the opposite. What covered California is a perfect example of the private market and competition driving down the premiums, because those plans had to compete in order to be selected as qualified health plans by covered California. So I think that's an excellent example of how you can
Therefore, 4 companies don't compete. They're an oligopoly.
His argument, though, is that you can work together, that you could actually have the insurance commissioner working in tandem with covered California, and you get the best of both worlds.
Well, covered California, 3 of their board members and their executive director have all stated publicly, and we have it in from them, that they feel that that Prop 45 would hinder their ability to conduct their business. So it's not the No on 45 side that's saying this. These are the folks who actually run the exchange.
What the No on 45 is saying is that it's false in TV commercials. You have to choose between an independent commission, covered California, and insurance commissioner having powers to regulate rates. That's not true. You can have both, and in fact, covered California has not taken a position against the initiative. The 3 appointees were political appointees who, in the Schwarzenegger, Davis, and Brown administration, opposed rate regulation through the legislature. Covered California does a fine job of bringing products to market, but the people who are staffing it come from the industry. Many of the people who created it went back to the industry. They're more like a brokerage. The elected insurance commissioner, accountable to the public, should have the right to say no when a rate is excessive. And we know there have been rates that are excessive that people have had to pay because regulators have said they're excessive. That is wrong in a system where you have to buy and
What are the arguments that you... Go ahead.
The LA Times, the San Francisco Chronicle, and Sacramento Bee have all endorsed against the proposition for the same reasons that I've just laid out here in my comments. And the coalition that supports the opposition here goes well beyond just those 4 insurance companies that Jamie refers to. It's doctors, it's hospitals, it's clinics, it's business, it's labor, it's hundreds of organizations and groups, including organized labor, throughout the state, who are on record as of supporting No on 45.
And the San Jose Mercury News and the Oakland Tribune and a whole host of papers have come out for 45. But the point is, the public doesn't have affordable insurance, and Prop 45 will provide that. And the people who get employer-paid insurance through big employers don't realize how hard it is for the little guy to afford insurance. Prop 45 will help them afford it.
Dr. Gallegos, you have the last word.
Well, ACA was implemented to solve that exact problem. And in a year, they've enrolled over 1 million people, and they're going to eventually have everybody covered under the exchange. So the whole goal, if we let it happen, will be affordable health care coverage provided under ACA. There's no need to implement something now that's untimely and not needed right now.
Your website is... Do you know it?
Yes, it's, hold on.
NoOn45.org?
No, it's...
Think about that. What's your website?
YesOn45.org.
NoOnHigherHealthCareCosts.org.
Which is a real honest name for the coalition, by the way, of insurance companies.
Thank you very much for both of you for joining us. Be sure to vote.